Ovarian cancer signs. Ovarian cancer statistics. Ovarian cancer can be challenging to detect in its early stages because the symptoms are often vague and can be attributed to other less serious conditions. However, it's important to be aware of potential signs and symptoms, especially if they are persistent and unusual for you. Common signs of ovarian cancer may include 1. Abdominal or pelvic pain. Persistent pain in the lower abdomen or pelvis, often described as a dull, aching, or cramp-like discomfort. 2. Bloating. Persistent or recurrent bloating and feeling of fullness, even if you haven't eaten much. 3. Difficulty eating. A loss of appetite or feeling full quickly when eating. 4. Frequent urination. An increased need to urinate, often accompanied by a sense of urgency. 5. Changes in bowel habits. Changes in bowel movements, such as constipation or diarrhea. 6. Unexplained weight loss. Sudden or unexplained weight loss, even if you haven't been trying to lose weight. 7. Fatigue. Unexplained fatigue or low energy levels. 8. Back pain. Unexplained back pain that doesn't go away. 9. Menstrual changes. Changes in the menstrual cycle, such as irregular periods or postmenopausal bleeding. Before we move on, would you please help us out? If you like this type of content, please hit the like button, subscribe to our channel, and turn on notifications. It really helps us on YouTube and helps others see our content. Also check out the description section below for special information to help you in your health journey. How is ovarian cancer detected? 1. Pelvic exams. During a pelvic exam, a healthcare provider can feel for any abnormalities in the ovaries or other reproductive organs. However, this method is not very effective in detecting early-stage ovarian cancer and is generally used to monitor changes in the ovaries over time. 2. Transvaginal ultrasound. This is a non-invasive imaging technique that uses sound waves to create images of the ovaries and surrounding structures. It can help identify ovarian tumors and cysts. Transvaginal ultrasound is often used in combination with other tests. 3. California 125, blood test. California 125 is a protein that is sometimes elevated in the blood of women with ovarian cancer. However, California 125 can also be elevated in non-cancerous conditions, and not all women with ovarian cancer have elevated CA 125 levels. Therefore, this test is not a definitive diagnostic tool but can be used in combination with other tests. 4. Imaging tests. Computed tomography, CT, scans and magnetic resonance imaging, MRI, can provide detailed images of the abdominal and pelvic area, helping to identify the size and location of tumors and potential spread to nearby structures. 5. Biopsy. If a suspicious mass or tumor is detected through imaging or physical examination, a biopsy may be performed to collect a tissue sample for examination under a microscope. This is the most definitive way to diagnose ovarian cancer. 6. Exploratory laparoscopy or laparotomy. In some cases, a surgical procedure may be necessary to directly visualize the ovaries and other abdominal structures to confirm the presence of cancer and assess its extent. This is often done when other tests are inconclusive. How to prevent ovarian cancer? 1. Oral contraceptives, birth control pills. Taking birth control pills, oral contraceptives, can reduce the risk of ovarian cancer. Consult with your healthcare provider to discuss the potential benefits and risks of using birth control pills. 2. Pregnancy and breastfeeding. The risk of ovarian cancer may be reduced by having one or more full-term pregnancies and by breastfeeding. However, family planning decisions should be based on personal and medical considerations. 3. Tubal ligation. A surgical procedure to close the fallopian tubes, tubal ligation, may reduce the risk of ovarian cancer. This procedure is often performed as a method of permanent contraception. 4. Removing the ovaries and fallopian tubes. For women at high risk of ovarian cancer due to a strong family history or known genetic mutations, such as BRCA1 or BRCA2, preventive surgery to remove the ovaries and fallopian tubes, salpingo-oophorectomy, may be considered. This is a drastic measure and should be discussed with a healthcare provider, especially if you are at a high risk. 5. Healthy diet and lifestyle. Maintaining a healthy lifestyle may contribute to reducing the risk of ovarian cancer, although the evidence is not as strong as for some other cancers. Consider the following. Diet. Eat a balanced diet that includes plenty of fruits and vegetables, whole grains, and lean protein. Some studies suggest that a diet rich in antioxidants and low in saturated fats may help reduce the risk. Physical activity. Engage in regular physical activity, as it can reduce the risk of various cancers, including ovarian cancer. Maintain a healthy weight. Being overweight or obese may increase the risk of ovarian cancer, so maintaining a healthy weight is important. Supplements to prevent ovarian cancer. 1. Folate. Folate is a B vitamin found in leafy green vegetables, legumes, and citrus fruits. Adequate folate intake may be associated with a reduced risk of ovarian cancer. 2. Antioxidants. Antioxidant-rich foods, such as fruits and vegetables, especially those with vibrant colors, can help protect cells from damage caused by free radicals. While antioxidants are beneficial, taking antioxidant supplements in isolation is not recommended. 3. Omega-3 fatty acids. Omega-3 fatty acids found in fatty fish like salmon and flax seeds have anti-inflammatory properties and may be beneficial for overall health. 4. Vitamin D. Adequate vitamin D is essential for overall health. Some studies have suggested a link between higher vitamin D levels and a reduced risk of ovarian cancer. You can obtain vitamin D from sunlight exposure and dietary sources like fortified dairy products and fatty fish. 5. Calcium. A diet rich in calcium from sources like dairy products may be associated with a reduced risk of ovarian cancer. Ovarian cancer statistics. 1. Incidence. Ovarian cancer is relatively uncommon compared to some other cancers, but it is still a serious health issue. In 2020, it was estimated that there were over 21,000 new cases of ovarian cancer in the United States, and over 300,000 new cases globally. 2. Mortality. Ovarian cancer is often diagnosed at an advanced stage, which contributes to its high mortality rate. In the United States, there were approximately 13,000 deaths due to ovarian cancer in 2020. 2. Globally, it is estimated that over 180,000 women died from ovarian cancer in 2020. 3. Survival rates. The survival rates for ovarian cancer vary depending on the stage at which it is diagnosed. The 5-year survival rate for ovarian cancer is significantly higher when detected at an early stage, but it drops substantially for advanced stages. 3. On average, the 5-year survival rate for all stages of ovarian cancer is around 47% in the United States. 3. However, this rate can be much higher for localized cancers and much lower for cancers that have spread to distant organs. 4. Risk factors. Several risk factors increase the likelihood of developing ovarian cancer, including family history, genetic mutations, such as BRCA1 and BRCA2, and certain reproductive factors, e.g., never giving birth, early menstruation, and late menopause. 5. Prevalence. Ovarian cancer is most common in older women, with the highest incidence rates occurring in those aged 55 and older. It is relatively rare in women under 40. 6. Geographical variations. The incidence of ovarian cancer varies by geographic region. Some areas, such as North America and Europe, have higher rates than others, like Asia and Africa. These variations can be influenced by factors such as genetics, lifestyle, and access to healthcare. Disclaimer: always check with your doctor before trying anything, especially if you are on medication. This information is just to be used as general knowledge and not medical advice. Thanks for watching our video. Please hit the like button, subscribe to our channel, and turn on the notification button so you don't miss a video.